Time now for Morning Rounds, our look at the medical news of the week. First up, an issue affecting global health. A large-scale study released this week in the New England Journal of Medicine examined the impact of obesity across the planet. Our chief medical correspondent, Dr. Jon LaPook, took a closer look.
When 31-year-old Carlos Lazos left the Army Reserve, it didn't take long for him to gain 70 pounds.
Started eating more fried foods, a lot of fried foods.
His lifestyle as a long-distance truck driver was putting him on the road to diabetes. He's now dieting and exercising, but his experience is shared by millions across the globe. This week's report found that worldwide in 2015, an estimated 604 million adults and 108 million children were obese. In the U.S., almost 13% of children, the highest rate in the world. The highest in adults was in Egypt at about 35%. Professor Azim Majid from Imperial College London is one of the study authors. He says diets high in calories are a major reason, but there's another culprit.
In many of these countries, there's been quite a rapid change, for example, in employment, away from high physical activity jobs like farming or labouring towards more lower activity jobs like working in offices.
Excess weight accounted for 4 million deaths worldwide, 70% from cardiovascular disease. And it turns out almost 40% of those deaths were in people who were overweight, not obese.
I think people probably now know that being obese is bad for your health, but I think less people know that being overweight is also bad for your health as well.
Someone 5'9", weighing 169 to 202 pounds is considered overweight. 203 pounds or more, obese. Dr. Bruce Lee is a global obesity expert at Johns Hopkins University.
So the health effects include different types of chronic diseases like type 2 diabetes, heart disease, stroke. Many different cancers are associated with increased weight or being overweight or obese.
So, John, what do we do about this?
Well, there are measures that you can do as an individual, and then what can you do as society? This is a huge problem, and I think you really do need societal steps, systemic changes. I mean, individual, we all try to lose weight. It's one of the toughest things in the world to do, right? I'm not saying there's not a role for that, but it's really tough, and it's clearly not successful. As a society, there have been efforts in small areas like Albert Lea, Minnesota, where everybody gets together and says, let's change the community. Let's put in more walking paths. Let's go to the cafeterias and get rid of the junk food and put in better food. Let's go to the chefs and the people who own the restaurants and put in better things on the menus. And they've had success. So you're trying to create an atmosphere, an environment where you trip over healthy behavior. You don't have to make all these choices all the time. And then there's also, I interviewed Michelle Obama a while back about, the whole business about selling junk food to kids. And it's really tough. What she said to me made a lot of sense, which is they want to sell you their stuff. So if we don't buy their stuff that's junk, then maybe they'll start selling us stuff that's healthy.
Our next topic is somewhat related to our previous discussion, cardiovascular health, specifically its treatment with prescription drugs. A new review published by the European Heart Journal looked at the gender differences when it comes to the use and prescription of cardiovascular drugs. So, Dr. LaPook, what did we learn about the gender differences when it comes to these kind of drugs?
Well, first of all, to put it in context, the reason why this is important is a lot of the research on drugs, about how it gets absorbed, about what kind of effect it has been on predominantly males, including even on male animals, rats, in the laboratory. And so we don't know enough, and we know this for years now. We don't know enough about women. We also don't know enough about minorities because it's basically been done in a homogeneous population. So you take a look at a pill. We know that women are obviously different from men on the outside, but they're different on the inside.
Yes, we are.
Yes, you are. And that's good. Vive la différence. But you got to understand la différence. And you take a pill, you swallow it. Well, gastric acid is actually lower in women than in men. And there are other factors that make it so that the absorption is different. Then you think about how does it get distributed throughout the body? Well, women have a higher percentage of body fat. They tend to be smaller. They tend to have less blood volume, less blood plasma. And so the way that it gets distributed throughout the body is different. Then you get to the target area, the cell itself, where the medicine's taking effect. There are differences by sex there too.
Even on the cellular level, there are gender differences.
By hormones, and by the way, throughout the menstrual cycle, the hormones change. And in pregnancy, something you may
be aware of.
Or after menopause. So there are all these different areas. And then finally, how quickly does the body get rid of the medication? How does it metabolize it in the liver, excrete it in the kidneys. That has a difference by sex also.
Wow, okay. So the review also looked at the difference in treatment. What did it find there?
And we've known this too, that we tend to undertreat women when it comes to cardiovascular disease. So we do less prevention, less preventative medicines. When they need medicines for treatment, we tend to underdo that. When they need procedures, we underdo that. And we also, we know there's been a big education push to teach people that women can have atypical symptoms when it comes to heart disease, right? They don't have to have the crushing chest pain. They can have a little bit of nausea, a little bit of fatigue, and things like that.
So, Doc, short of getting more female lab rats, what do we need to do to improve our understanding of the gender differences?
Well, we do need to have more female drug rats, and we also need to have more women in these trials. So the NIH, I have to say, you have to give them credit. They've made a big push for this, and it's actually mandated by law that they include more women in these studies, have more diversity, and they're trying to do that. So you include them in the trials, and in addition, you have to think about how you report it out. Because when you report it out, you can't just say, here's the result. Yep. You have to break it down by gender,
right,
and hopefully in subgroups to say, this is what happens with women, this is with minorities, et cetera, et cetera. So we still have a long way to go.